My hope is that patients learn to reconnect with their lived experience, with their intuition, with their
Mhm.
thoughts and feelings, because I feel like we have spent a lifetime being dismissed, being invalidated. And one of the first steps to healing is to really reconnect to all of that.
Welcome to the Medical Trauma Support Podcast, where we come together to bring more humanity into healthcare. I'm your host, Sarah Stasica.
Hello, everyone, and welcome back to the Medical Trauma Support Podcast. Today, Casey Berna is with me, and I'm super excited to have you here, Casey. Welcome.
My goodness, I am so excited to be here and so grateful to be spending some time with you today.
Thank you. Me too. I wanted to do like a little brief introduction of you, and then I know that you're going to have a lot more that you can share with the audience about what you've done. But one of the really exciting things is that Casey just released her book. It's called Endometriosis: From Harm to Hope, a Chronic Illness Guide. And I read it, and it's amazing. So congratulations on that, Casey.
Thank you so much. I really was so grateful for the opportunity to write this book and to hopefully give a resource to folks who are struggling with endometriosis or love someone with endometriosis or medical providers who work with endometriosis patients, just to give more understanding and resources about all of the complexities, physical health and mental health, that we go through as patients.
Yeah, yeah. And I've already told people about your book because I think it's really going to help people who maybe have already had some experience in the medical system trying to navigate the support that they need for endometriosis, but also for people who are just starting that journey. One of the things you talk about in the book is just how long it takes for somebody oftentimes to get a diagnosis. So I'm thinking if enough people read the book, then it'll help spread the word. And so people aren't going years and years trying to get somebody to listen to them, validate their experience, and help them get a diagnosis.
That was the hope in writing this book, is how is creating another tool to help reduce harm that patients go through, whether physical or emotional harm, because yes, the delay in diagnosis and the invalidation, the dismissal, the gaslighting, the impact on essentially every aspect of life, and then also the physical impact of the diagnostic delay is huge and can be so devastating. So the idea is, if we can give folks more information and support them and connect them to the greater community, that hopefully they will have less trouble getting the care that they need.
Yeah. I feel like if everybody had even a fraction of this information, it would just make people who have endometriosis, their life so much better. They wouldn't feel as much of the need to explain themselves and get invalidated and have people say, well, why can't you go? And I'm obviously diving deep into the conversation before I've even fully introduced you, Casey. But I'm excited. I'm excited about this conversation. But also, I'll just quickly say for the audience that Casey is a licensed clinical social worker and also has done a lot of advocacy work. You were involved in a film. So I was wondering if you would tell the audience a little bit more about the film.
Absolutely. So I there actually had the opportunity to be involved in two different films. When I first started working as a licensed clinical social worker with endometriosis patients, I really started realizing that their experience in sort of diagnostic delay, feeling dismissed, really having trouble getting the care that they need, was also very similar to my own. And I wanted to create a video that explained the impact of endometriosis and infertility on mental health. So I created a short documentary that I made on a flip camera. It was like very rudimentary, and just I spent a whole day inviting different endometriosis patients to my office and just filmed them for hours. And they also sat in community, and then just created a short video on really the impact of what they went through to get a diagnosis, and then how hard it was to get the care that they needed, and then what life looks like on the other side, continuing to struggle with the disease, but also having the knowledge and empowerment of community and sort of like what that means as well. So that was really exciting.
Yeah.
That was in a film festival in New York City, so that was really fun. And then I had the opportunity to be like have a teeny tiny role in Shannon Cohen's amazing documentary that was a really incredible piece that really shows, advocacy, what individual patients go through. That's called Below the Belt. I was technically an assistant producer on that, but again, I had like a very tiny role. But I think anyone who wants to learn more about endometriosis, learn about advocacy, about policy, about all the things, should see this film. It was executive produced by Hillary Clinton. I mean, Shannon's moving mountains. She does amazing things. So, and that's Shannon just announced that it's being showed at Yale Medical School. It's going to be a part of the curriculum. So that film is amazing, and I really recommend anyone who can to see Below the Belt because it is really like a profound film.
Wow. Well, I will watch it. I haven't seen it yet. So now I'm going to go watch it, and I will share a link to it in the show notes for anybody listening so you can quickly get to it. One of the things that I'm so curious about whenever I talk to people on the podcast is what their story is that brought them to have, the passion that you clearly have for supporting other people and educating, and the time you've put into advocacy around endometriosis. So I'm curious if you would share a little bit about your story.
Absolutely. I think like the majority of endometriosis patients, I started experiencing symptoms of endometriosis before I even got my period. So from a young child getting migraines, having stomach issues that I didn't understand, things like that only escalated when I got my period. And I can remember as a teenager just dealing with chronic diarrhea, period pain, migraines, all of these things, fatigue. And it was in high school I started noticing that I was a little different from other people, right? Like that I had these sort of health issues that I didn't really understand, that I think folks around me were attributing to anxiety or doing too much or not taking care of myself. So I think the sort of dismissal started at a young age as well. And then when I got into college, the symptoms escalated, and I all of a sudden was at a GI doctor and getting upper GI series, lower GI series, colonoscopy. And at the end of it, he said to me, I think you just have anxiety. I think you have irritable bowel. And I'm kind of like, you don't understand. Like something feels terribly wrong. And you would have anxiety too if you were falling asleep at parties and having like constant diarrhea, right? Like, yes, I have anxiety over like, what is happening in my body. So I think
Wow.
that sort of just kept escalating to where I would know when I was ovulating. It was very painful. My periods got very painful. And I got married young, and I can remember just collapsing in my apartment, passing out at age 23 and going to the emergency room and them telling me I had borderline appendicitis, which I now know I probably had endometriosis on my appendix. But again, even after surgery, no one saw it, right? No one said, hey, we took your appendix out, but also you have endometriosis. You should go see someone about that. The system failed me time and time again, like it does so many other patients. I was eventually diagnosed by my reproductive and endocrinologist after having infertility. But again, the how serious the disease wasn't told to me, and I still wasn't directed to the care that I needed. And it wasn't until years of infertility, pregnancy loss, a gallbladder removal that I finally was able to figure out myself that I needed extra help with this and get tapped into the endometriosis community. And I think after going through all these struggles as a social worker, I was like, wow, my social work degree can really be helpful in supporting others like who have gone through this.
Yeah. Yeah, I think about that as a fellow social worker about how, we're really trained to look at the systems. Why is something happening within this system? And like, what are the things that we can change in the full system, which is not, it's not easy to change a system.
Oh, especially a system where those making the rules are profiting off of how the system is set up, and it's incredibly hard to change it. And I think there's so many reasons why endometriosis exists at an intersection where it's incredibly difficult. I feel like women's pain is often dismissed and not taken seriously. I feel like there's stigmas surrounding reproductive health. And also, there's a paternalistic view that unless you want to have babies, what's going on reproductive wise, like, does not matter. There's also stigmas talking about it. And then just a lack of research money. I mean, it's just a nightmare. Like, endometriosis is uniquely set up to have these systemic challenges, which is so unfortunate for patients because it leads to their suffering.
Yeah. Well, one thing that I was wondering is, do you have like a particular moment when it was that aha moment of, okay, this is what's happening, this is the plan? And if so, was there a person that helped you get to that, or was it just a combination of these many experiences that you'd had?
I think before working with patients individually, supporting patients individually in private practice, I started dipping my toe into advocacy work. I worked with Resolve in going to their advocacy day and talking to politicians about how to change policy to help support patients. Also, as you mentioned, from a social work perspective, we're often trained to look at the bigger picture. I think what really encouraged me was when I did start working with patients individually and started learning more about the nonprofits in the community. It was very clear to me that no matter how much individual therapy or group therapy you support endometriosis patients with, as long as the systems are out there that are creating this medical trauma, that are leading to more depression and anxiety for patients, as long as those systemic harms existed, almost not that it didn't matter the individual work because it's really important, but it became clear that it was crucial to do both. And I have an amazing mentor, Heather Guidone, and she has been doing this longer than I have and really helped teach me about the systemic issues and teach me at the heart of it where things like pharmaceutical companies intersected with, say, practice guidelines, helping me understand why the standards of care are the way they are. And so just learning from her and other advocates like Nancy Peterson and others who have been doing this for so long, I was able to learn more of the landscape and realize just how hard it is, like, the great challenges ahead for patient advocates, but also, little by little, just moving the needle can provide some care and relief for patients.
Yeah. And I'm thinking about your journey and how all of these things were educating you too about more than just your own experience in your body, but what was happening medically, what policies are impacting. And one thing that I really love to like share on this podcast is oftentimes almost every person I've talked to on this podcast, we've all had these moments, these really dark moments. And then we start to find the resources, the support, the people that help us climb out of the darkness. And that doesn't mean that we're not going to like have moments where we dive back into hard times, But I'm so curious about what some of those are for you. Like, what were some of the things that helped you get to a place where you can have a thriving therapy practice, how you have the energy to do the advocacy work? What are some of those things that helped you get to this point?
Absolutely. I think that's such a great point to bring up is that, especially in the endometriosis community, all of the advocates who are working towards change, we have chronic illnesses ourselves. And with endometriosis, it's often not just endometriosis, right? There's usually like a whole, I like to call it a chronic illness stew of like just different comorbidities and all different health challenges that exist with it. And patient advocates do try and work under these circumstances. And the nonprofits in the endometriosis community that are patient led, like they're not getting paid, right? So they're often doing this while navigating a full time job, while navigating life, while navigating chronic illness. So I think it can be challenging. I can remember I not only have endometriosis, but I had adenomyosis, which is sort of a chronic illness that impacts the uterus and causes extreme pain, extreme bleeding. And I also had fibroids, which again, these things are often comorbidities. And I can remember having to do a speech in Boston at a March rally and just bleeding horrifically. Like, as I was talking, I was like holding on to the podium, just like, okay, I just need to get through. I just need to get through this and just sort of like collapsing. So I feel lucky I'm in a really good place health wise now in that I've had multiple endometriosis excision surgeries. My thyroid is doing great thanks to medicine. I don't have a uterus anymore that is trying to kill me. So, um, I feel like I have a quality of life now that gives me more freedom to do the work that I'm doing. And I'm very grateful for that. I hold space for younger me that had to work while feeling really sick, and especially when I didn't know I had endometriosis or really how sick I was. And yet also I don't know. My thyroid doctor was like, "Hey, there's more scar tissue. Like, are you feeling more tired?" And I'm like, "Oh, I don't even know what that means. Like, I don't know if I'll ever know what it feels like to feel healthy because I feel better than I have in years. But also, I know probably my healthy is not the same as other folks."
Yeah. And I think there are probably a lot of people that are listening that like viscerally understand what you're saying right now, whether their experiences with endometriosis or not, that just deep fatigue that comes along with a lot of chronic illness and also the fatigue that comes along with chronic pain and just how being in constant pain depletes your energy. The other thing, I talk a lot about the nervous system and having ways to support ourselves every day, not only when we're going through hard things, but I was curious if you had any kind of practices that you have used to soothe yourself and help like support yourself as a person who has chronic illness.
Absolutely. I think what I have found is a lot of folks with endometriosis and they're finding more research to support this is that neurodivergence goes hand in hand with endometriosis. So what I found in my practice is that I see a lot of folks with ADHD. I see a lot of folks who are on the autism spectrum. I also think it's important to recognize that what is good to calm the nervous system for a neurotypical person is not necessarily the same for a neurodivergent person. So I think for me personally, what regulates my nervous system, a great pelvic floor therapist taught me finger breathing. And that's sort of like I know there's box breathing, there's other stuff, but I found sometimes for neurodivergent folks like that can be more stressful. So finger breathing is a great trick because you can do this anywhere. You could do this while driving. You could just like keep your finger down. You could do it in a doctor's appointment and you just kind of like touch your thumb to each finger and you do like a little breath like and then thumb to the middle finger and then thumb to the ring finger, and then thumb to the pinky finger. And so I like this because you can breathe at your own pace. I work sometimes with folks who have thoracic endometriosis, and so breathing can be hard. And so sometimes with belly breathing or other breathing, you're encouraged to take big breaths with which actually can feel uncomfortable for folks. So this is like a really benign way to breathe. And what I talk about a lot is, the nervous system, when it's in sort of like a state of crisis, it feels like a bear is chasing you, right? Like that's literally like this part of the brain is activated. So, how do you remind your body that when you're in a doctor's appointment and you're feeling very stressed about it, right? And maybe you're activated, you know, or maybe when a family member is trying to talk to you about things and they're not being sensitive, and then you get in this heightened state of crisis. So the breathing can be like a very good technique to remind your body, like, hey, like, we're not being chased by a bear, we're safe, we're maybe uncomfortable, but ultimately, like, we're not in immediate physical life threatening danger.
Yes. Yeah. I love that because I know that there are so many of us who feel, even weeks before an appointment, feel like we are absolutely like walking to our death sometimes. I mean, that is what the nervous system can feel like. And so I love that we're talking about that because I think it just helps people feel like they're not alone in that, because I know oftentimes people can feel a lot of shame about having these nervous system responses. And some people's responses are they go into fight and they're irritable, or they go into flight and they leave an appointment. And then sometimes people shut down. And so they, in all those states, really, it's very hard to cognitively follow what the conversation is, to remember anything you talked to your doctor about, to remember the questions that you wanted to ask your doctor.
Yeah.
And then, when people go into shutdown, sometimes they literally can't even get the words out. And so that's one of the reasons I love to talk about the nervous system, because I feel like it's letting people know, like, you didn't do anything wrong. This was your nervous system response to
Yes.
danger, right? Because you have experienced that previously in medical settings, whether it was, for some people, it was an acute illness. For other people, and I'm guessing, and especially from your book, so I'm not really guessing, but I know that a lot of times people who are searching for a diagnosis and help for a chronic illness and chronic pain that's not very quickly and easily able to be diagnosed, they experience dismissal, invalidation over and over and over again.
And really, like, that's a form of emotional abuse, right? Gaslighting is emotional abuse. Medical
Yes.
narcissism is emotional abuse. So that's the other thing too, is that patients are getting harmed, right? There was a patient campaign to have anesthesia with IUDs, right? Because it was so incredibly painful. And so for endometriosis patients, a pelvic exam can be painful, a speculum can be painful, and often that discomfort is faced with dismissal or shame or, guilting. I can remember having a gynecological exam being done and me just really being scooching to the top of the table, right? Because it hurt a lot. And the doctor being like, that shouldn't hurt. You need to relax. That shouldn't hurt. And it did hurt because I had disease there, right? Like, and so we are exposed to
Yeah.
harm. And so we shouldn't feel
Yeah.
ashamed about our reaction because it is our body trying to protect us. And also the fawn response, I think, is important to mention too, and often
Yes.
females do this, of, trying to make the other person feel more comfortable so that that person won't harm them, right? So while we're being harmed, we're actively trying to be polite so it ends as quickly as possible, or to try to reduce our harm.
Yeah. And then when we leave, the complexity of having fond and the shame that we have for ourselves when it was a response just to try to protect ourselves. But yeah, I'm so glad you brought that up. When you said gaslighting is emotional abuse, I think that so many people listening are going to really feel that because I've talked to a lot of people through my peer groups, through the podcast, just through other conversations. And I think that a lot of people who aren't having these conversations would be shocked to know that when people are remembering the medical traumas that they've experienced, it is often the gaslighting, dismissal. I just think it's so important for us to highlight what you said, which, gaslighting is a form of emotional abuse, and we're going to be impacted by emotional abuse. And I think one of the things about medical trauma is when we step into a space in some of our most vulnerable moments of our lives, in a space where we expect to be cared for and we expect to be able to find healing, it is a big shock to our nervous systems when we aren't treated that way.
Yes.
And it has a very deep, deep impact.
Yes, absolutely. And then also our dependency on the system that's harming us just adds another layer of difficulty that we need medical care. Those of us with chronic illness, we depend on medical care. Our life depends on medical care. But then we learn that medical care can be harmful, that it can cause emotional abuse, that we have to endure emotional abuse and sometimes physical harms in order to get that medical care. And yet we can't exist without it. So it is this really, it's like being in a toxic lifelong relationship that we can't escape, right? Like we can't leave the medical system. We have to be a part of it because of our health issues. And yet it is not a healthy relationship. So how do you integrate all of that? How do you process all of that? It is incredibly difficult.
Well, there are two things that are really coming up right now in this conversation. One is grief, and I want to talk about that because there are so many different types of grief that come along with this. And this kind of losing the illusion of the care that you expected, there is a lot of grief with that. But the other thing that I want to talk about today is the importance of care providers being educated about endometriosis, but also being educated about medical trauma, the nervous system, how their own nervous system is responding is crucial because, I have talked to some amazing, passionate, really wonderful medical providers on this podcast. And I actually had, a podcast where I had, an ICU doctor and, the person who was their patient, and just how loving and compassionate that ICU doctor was and the impact that it had on that patient's life and is maybe why that person is alive today. And so I wanna talk a little bit about that too, because, we talk about systems as social workers, and that is such a big piece to this puzzle. But before we go into that, I do wanna talk about grief and how grief is such a big piece to medical trauma, to chronic illness, to chronic pain.
I think for endometriosis patients, the grief is profound and multifaceted. It can feel endless. So I think having the disease itself, it's a devastating disease that impacts so many systems in the body, that impacts fertility, impacts our capacity to function. So I think the grief of having a devastating chronic illness that has so many different impacts on the body is really profound. And so within that, it impacts a person's ability to work, right? So, or go to school. So you have to constantly shift and grieve hopes and dreams that you wanted for yourself. Whether I've worked with folks who had to drop out of law school or folks that couldn't work as a childcare provider because, or a teacher, because standing on their feet all day and working with young children was really difficult. it really impacts your hopes and dreams. And then in terms of fertility, a lot of folks with endometriosis, not everyone with endometriosis has infertility, but a lot of folks with infertility have endometriosis. So the loss and grief of family building in the way that maybe you hoped it would be, or with the ease that could be, is really devastating. And then grief in relationships, it's very isolating. And then also, like you mentioned, the grief of navigating the medical system, having your illness be a part-time job or a full-time job, grief and not even being able to access the care you need. Again, I feel like there is just layers and layers and layers of grief that comes with having endometriosis.
Yeah, and in your book, you talk about that, right? You go into more detail about like grief and other emotions that come up around it. I loved how you organize the book too, because you can read it all the way through, but then you can also jump to sections, which I think is really helpful for people who are in feeling chronic pain, right? Like it may be hard to sit and focus on reading or focus on anything, but to be able to like jump to a section, read it. Yeah, I thought that that was a really nice way of setting the book up.
Thank you so much. And I know you mentioned before talking about trauma informed care. Even within the book, it's like how just the idea how can you make a life as easy as possible? How can you make the information as condensed as possible, user friendly as possible, inclusive as possible? How do you reduce harm even in creating resources? So I'm grateful for your comment. I tried really hard to do that.
Yeah. I wanted to go to something that you and I talked about before we started this is the conversation about clinicians, right? If you had you probably have before, but if you had a room full of healthcare providers, and this includes therapists, right? Because there are a lot of therapists that aren't familiar with medical trauma. And I've talked to people who've been harmed when they've gone to go and get mental health support after medical trauma. And so I think it's really important that when we talk about educating providers, that we're talking about the people that are providing the mental health support as well. So you have this whole room of doctors and nurses and mental health providers, therapists, psychologists. What do you want them to know?
Okay, I think what I tried to do, I could also talk about what I try to do as a provider as well, and what I've learned is most helpful. And so I try to look at every patient like it could possibly be their worst day, right? And I don't even know the depths of the trauma that they could have possibly have been through. I don't know what microaggressions they may or huge aggressions they may have experienced within the healthcare system. And so I have this really unique opportunity to lead with empathy, provide a validating space and provide healing for those experiences. Maybe, and I'm not perfect as a provider and I have caused harm and I have learned, but, and also like, how do I try and change their narrative for what healthcare means? So I think from little things of policies of for chronic illness, you can cancel anytime. I'm not going to be mad at you.
Yeah.
I've had folks who've had their providers
Yeah.
cut them off because they kept missing sessions. I'm like, why are you going to work with chronic illness folks if you're going to be mad about them missing sessions? Like, that's not fair. Like, that's not ethical. And then to like
Can we
charge them
pause there
for
for a
it.
second?
Yeah.
Yeah, and to charge I want to pause here because I think this is really, really important that when we are working with people with chronic illness and chronic pain, and we penalize them for missing a session because they are already in chronic pain, it feels so cruel. And I know that is more the norm. That's what most people are doing is that they're charging people when they have to cancel when they're in pain.
Yes. Yes. It's mind blowing to me. I don't understand. I don't understand how that can happen. Also, I try to be really mindful like how can I make my services most accessible? So I try to take as many insurances as possible. I allow room in my practice for reduced rate because folks with chronic illness are juggling so many medical bills, right? So if I believe mental health care is an important multidisciplinary part of supporting folks with chronic illness, then how can I make it more accessible? And how can I be flexible about virtual sessions? I have a heating pad in my
Yeah.
office, so just little things like that environment wise, but then trauma informed care is also learning about anti-racism practices, right? It's learning about what it means to be present for those most marginalized and minoritized. It's making sure that I am not contributing to the impact of what racial bias has on folks, right? So just being aware of how I can be most trauma informed for everyone in my practice, everyone who comes. And then the other thing I think is knowing your limitations. So if I have someone who comes in who say often folks with endometriosis can have eating disorders, right? So I am not trained in disordered eating. And so how do I work with their primary therapist or get them a primary therapist to help them with that? And then I can still support them with endometriosis, but I need to know my lane, right? Like, or if someone wants EMDR training and I'm not trained in that. So, like, a collaborative approach is trauma informed, a multidisciplinary approach is trauma informed, and then knowing what you don't know and then helping your client get that information is also trauma informed. And then just like little things like
Yeah. I was
yeah,
gonna say for people who hear, "I don't know the answer to that, but I'm gonna find it for you." And I know this is we're butting up against systems here and how a lot of medical professionals are trained is like they're shamed if they don't know. Like, I can't tell you how many people I have talked to who have said, "I would love it if one of my care providers were to say, I don't know the answer to that, but thank you for bringing that information to me. I'm going to find out for you." Like, it is okay to say you don't know. And I just think about if we all could feel safe in our own systems saying, I don't know, I think it would significantly minimize the gaslighting that
yes.
happens to people in medical systems.
Yes, I think that's really what patient centered care is, right? If you can't admit what you don't know or gaslight a patient or dismiss them because you're not aware of something, you're centering the care on yourself as a provider. But if you truly
Yeah.
center the patient and lead with empathy and what they need, then it can be life changing. Even if you don't have an answer, at least you're not saying what they're feeling and experiencing is wrong or untrue or and that in of itself,
Right.
it's a low bar, but unfortunately, it's a bar that's not often met.
Yeah. Yeah. And I interrupted you. I know you had more that you were sharing with what you would want to say, but I really wanted to highlight that because it is such a common thing that people experience with medical trauma.
It is all too common, and that's so heartbreaking, and I think what I was gonna say is even little things like having an administrator who answers the phones who isn't grumpy or dismissive, right? Like, also
Yes.
getting back to folks right away, like, or at least letting them know how long it's gonna take to get back, and then following up on that, right? And then also admitting when you make a mistake. So sort of like, "I'm sorry, we forgot to put in your prescription. Our bad.
Yeah.
We're gonna fix that right away." Or, "I'm sorry that I missed endometriosis. I see you've come back and you've had surgery and I dismissed you. I'm really sorry." So just like little things because patients, it's so hard to be a chronic illness patient. So when you call the administrator and they dismiss you or they're rude to you, or you call to ask a question about a medication you can or cannot take, and then you don't hear back. And then when you do hear back, instead of getting, "I'm sorry," you get like someone who's cranky or projecting, right? Like it just makes everything so much harder.
Yeah, and I think one thing I would say to people listening who are involved in patient care at all, is like, you probably don't know how many times somebody leaves your office and goes and cries in their car because somebody was mean to them or dismissed them and they're in serious pain and they're just trying to find out what's going on. Just to me, I just want to bring the word human in for all of us. We are all humans. We are doing the best that we can. No human is perfect. Every human's going to make mistakes, but the more that we can hold our own humanity and we're able to hold the humanity of other people, it changes the whole experience for everyone involved. I'm so thankful, Casey, that you shared those different things that we want clinicians to know. And I thought it was beautiful that you shared it from the perspective of you as a clinician, right? Sharing the ways that you try to be thoughtful and be trauma informed and the ways that you try to show up. Again, recognizing that we are all human and no one is going to get it right all of the time. But when we can keep showing up and trying, that's how we move forward. When we can acknowledge, like, I messed that up and learn from it and move forward, we're going to change the world, right? Eventually. But the thing that I really wanted us to talk about before we wrap up this episode is an area that is so impactful to all of us, and that is our community. That is our friends and our families and our workplaces too, right? And the impact that chronic illness and chronic pain has on the relationships, but also it's really important that we talk about the impact of how our friends and our family and our coworkers, how they show up with us when we're struggling. You talk about this in the book, and I would love for you to share some of this with the audience of, what I think is going to be what a lot of them have experienced, and that is somebody makes a really cruel statement. And maybe they don't mean for it to be cruel. Maybe they do. But I'd love for you to talk a little bit more about that and how to handle it and how to maybe look at it from maybe a different perspective, right? So you take it in a little bit less, maybe.
Yeah, it's so tricky because I think we desperately want our friends and family to understand what we're going through, to have deep empathy for what we're going through, to say the right things, to show up in the ways that we need. And sometimes
Yeah.
our family members just don't have the capacity. And we talked
Yeah.
about grief before, and there is a tremendous amount of grief that goes into that. And in that grief is denial, bargaining, anger, right? We kind of go through all of those phases before we can really truly adapt to the capacity of our family members. So a lot of times folks will come to me for support with endometriosis and or its comorbidities, and then we start talking about their parent who seems like they may be narcissistic, right? And that
Yeah.
there's been a lifetime of dismissal of the patient having to show up for their parent instead of the parent showing up for their patient, and just
Yeah.
the profound impact having a parent with mental illness has on anyone, but for someone with a chronic illness, the impact feels so much bigger. And so, how do we understand that these comments come from a place where the family members just don't have the emotional intelligence, the emotional capacity, the emotional wellness to be
Yeah.
supportive? And I think as children, when we have a parent who has, say, a personality disorder, narcissism, or anxiety, depression, that's often untreated, we needing that parent try to bend ourselves in ways to have a healthy relationship or a relationship with that parent in ways where we have to abandon ourselves and put their needs first and
Yes.
or shrink ourselves so we don't get harmed. And as we become an adult, we still have that innate behavior that we learn to protect us from harm in order to negotiate with our families who we feel like we need. But when we are an adult and have chronic illness, those behaviors we had to adapt to don't serve us anymore, right? Like, and so how to learn their capacity, how to grieve that we don't have the support we need from them, how to put up
So much.
boundaries. So
I
much
was just
grief.
saying,
And like, yes, it's like the little
yeah,
girl in you, the little child in you who just wants their mom to take care of them and have empathy, still wants that as an adult.
yeah,
So how do you continue to grieve that, to adapt to it, to understand it more, to not blame yourself, put up boundaries so you don't
yeah,
get harmed, and then also
yes,
find support elsewhere, in ways that are healthy and with people you can have a healthy relationship with.
yeah. Yes, oh my gosh, and it's not easy work. That's
No,
really hard work.
and there it's such cruelty, the cruel statements of, I mean, maybe if you lost some more weight, you'd feel better. Or, cousin Susie had one surgery and felt better. Why aren't you feeling better? Or when am I gonna get my grandchildren? When am I, like just all these things of, or maybe if you thought less about being sick, you would be less sick. There are so many statements that can really be cruel and harmful. And half the time, the person saying it, that's not their intention. They don't even know, but it still has a profound impact.
Yeah, and I think even if they aren't trying to hurt you, what it shows is they don't have the capacity to think before they say it about the impact that it could have on
Yeah.
you. Yes, maybe your mother is really excited about grandchildren, but she doesn't need to say that to you. If she had the emotional intelligence and capacity to slow down and think about how would this statement impact my child, she's
Yes.
not going to say it.
Yes.
This kind of work is really important work. It's things, even if we are blessed to have emotionally mature, intelligent family members, you're going to run into people, friends, coworkers that aren't,
Yeah.
right? And
Yeah.
so I think that this is such an important piece to this conversation is the communities that we're in. And the more we can understand that not everybody has a regulated nervous system, has the capacity to be with us, it can help us to not get quite as impacted. I'm not putting the blame on us to not get impacted, but I just mean when we can see it in that way, it helps us take a little step back and go, wait, is that true? Is that about me? No. No, that was just a cruel statement because it's so easy for us, especially when we are feeling very vulnerable because we're in pain and have chronic illness and we're navigating medical systems and we're trying to figure out what's happening. It can be easy to hear those things and take them in and to start questioning ourselves like, well, maybe if I did try a little harder, maybe I can do this. Maybe I did this wrong. Oh, if you're feeling that way, it just means you're human. But I'm hoping that through this conversation, it helps people just get a little bit of space to take a step back and go, wait, what is that really about me? And 99% of the time, it's not. It's about the person that's saying the statement. So I'm so glad that you talked about that, Casey. Thank you so much for sharing that and sharing it in such a nice, clean way for people to kind of be able to think about it.
To add to that, what I often say to patients is that reasonable to say? Would you say that to someone else? And often they're like, no, never. I'm like, okay, well, if you wouldn't say that to someone else, that means it probably shouldn't be said to you, and that the person saying that to you is not correct in what they were saying.
Yeah, and not being thoughtful. That's really not a thoughtful thing. Yeah. I love that. What a beautiful question to ask yourself. Is that reasonable? And would you say that to somebody else? Wow, that's good. Casey, thank you so much for being here. And like I said, I wish that I could talk to you for like 5 hours because I have so many questions. But I was hoping that you could leave the audience with, what is something that you really want everyone listening and watching to take away from this conversation?
I think what I would love for patients to take away is that you will find providers and communities that believe you, and that it's so important to believe yourself, to believe your lived experience, to believe how others are making you feel, whether it be a provider or a family member. Just really believe in your pain and your experiences, because I think for too long we have been dismissed, invalidated, whether it be by well-meaning family members or by medical providers, and we learn that it's impossible to listen to ourselves because no one else is going to listen to us. So we sort of have to dissociate from how we're really feeling. So to sort of trust ourselves again and believe ourselves, and then find community with others who will also be supportive.
Yes, yes. And you deserve that, right? You deserve to be with people who believe you.
Yes. Yes.
It
Yeah.
just always, it's like, that's not a lot to ask. It's not a lot to ask that somebody else believes you about what you are feeling in your own body.
Yes. Yes.
It's very, it's baffling to me that anybody would be like, oh, well, you're telling me this about your own body and this is how you feel. Oh, I don't believe you. Like, what? That doesn't make sense.
Yes, and I think that's where paternalism in society comes in. Women are often seen as hysterical, especially if you're part of a marginalized or minoritized community that gets more easily dismissed. I think it's ingrained in society, in the culture, in the medical system, really in everything. I think reclaiming our thoughts, our feelings, and our lived experiences is incredibly important.
Yes, that's so beautiful. And then I would love for you to let people know how they can find your work, how they can find your book, and then anything else you have that's coming up. I know you're going to be doing a book tour. So if you want to share some of that stuff that's coming up, that would be great.
Absolutely. You can find more resources for endometriosis and chronic illness, free resources on my website. It's caseyberna.com. I'm on Instagram at Endo Social Worker, and you can see the video that I made. It's free on YouTube, on my YouTube account, which is linked again from my website. And Below the Belt is a website in of itself, the documentary I talked about, Shannon Cohen's film. And part of my book tour is there are different places where I'm going to be a part of that film being viewed and then on a panel afterwards. So you can find that on my Instagram account. But also you can contact Shannon and her website, Project Endo Global, and actually have a screening yourself if you want. There's lots of ways to, you know, be able to view the film. And my book, you can find my book. Forgot about my book. You can buy the book wherever you like to buy books. So it's really wherever you appreciate buying books. I often send folks to bookshop.org because money goes to local bookstores. It is now on back order, which I think is a good thing on bookshop.org, my book, but I know, but you can really get it anywhere you prefer to buy books.
Great. Thank you so much for being here. And I'm going to put all of those links in the show notes so people can quickly jump to them. But this was such a great conversation and I loved reading your book. So I feel like I just got a lot of your wisdom from the book and then from this conversation. And so I'm really thankful to you for all the work you're doing, but also showing up here and sharing your time and expertise. Thank you.
Thank you. I'm grateful to you and you sharing your expertise and really bringing light to medical trauma. It is not something that is talked about a lot and yet impacts really everyone. Everyone has to deal with the medical system, and so they deal with medical trauma. So what you're doing is incredibly important, and I'm so grateful to have been able to have a conversation with you.
Thank you for saying that.
Thank you so much for being here and for caring about bringing more humanity into healthcare. And if this conversation meant something to you, please share it so more people know they're not alone in their medical experiences. You can find resources, education, and our peer support community at medicaltraumasupport.com. And if you enjoyed this episode, please follow, subscribe, and leave a review. It really helps more people find this podcast. Take care of yourself, and I'll see you next time.